Hi Instagram, this is Dr. Maria Muto-Rodriguez again, and we're going to talk part 2 of some pelvic floor conditions that can exist in the pregnancy, postpartum time, or just if you're a person with a pelvic floor, which is everybody. So now we're going to talk about pelvic organ prolapse. And so if I bring out my pelvic model again, like I did in the first video, I'm going to just show you the pelvic floor. This is the top down view, and then this is bottom up view of those same muscle groups. If I actually take the first layer of the pelvic floor, put it back, this is what we would see here. So in the pelvic cavity, we have a lot of different organs. So the pelvic floor supports our abdominal and pelvic organs, but I'm gonna just show you the 3 pelvic organs that lay in this area. So if you are a female, we have the uterus, we have the bladder that sits in front of the uterus, and then we have the rectum that sits behind the uterus. So when we have a pelvic organ prolapse, one of these 3 organs are going to slip down and descend into the vaginal opening. So the vaginal opening is right over here. So you can literally actually see a hole. So these are your vaginal lips. This is the opening. And so if the bladder or uterus or rectum has kind of lost its position because there's a lot of stretch on those ligaments, if you've been in pregnancy, there's a lot of stretch in our ligaments as we progress because we need to create space and room for baby. And also, you don't need to be pregnant or have gone through pregnancy or postpartum. You can be somebody who lifts weights and actually creates a lot of pressure in the abdominal cavity. So you are actually holding your breath when you have a lot of external load on you. If you are bending down to pick up something and you're holding your breath, or if you're someone who is straining when you're trying to pass a bowel movement, you're not exhaling as you're pushing, it creates a lot of pressure in the abdominal cavity. It can actually make the organs a little bit looser. And the ligaments around the organs looser, and then the organs kind of lose their position. And so again, you might see it in that opening there. Now, what we can do to help support this, it really also depends on the severity of the condition. So it goes for 1, 2, 3, and 4. 4 is the most severe. It would actually be, the organ's not going to just like hang out of the vaginal cavity, but it can descend out, and then we have to really try to push it back in. That is usually recommended for surgery because that will really impact your quality of life. You may not want surgery, or it's for a different time, and you might want to use something called a episiotomy that helps keep the organ in place so it doesn't really slip out. But if you're more in the 1, 2 degrees of the slippage, it's much more manageable. Some people may actually have, let's say it's like the bladder, right? And you're trying to urinate and you can't get a full emptying. You might actually have to like put your finger inside of your vaginal opening and try to apply some pressure just to help reposition the bladder so you can let everything out. But from a physical therapy standpoint or managing your symptoms, you can actually lay down flat on your back and allow your legs to rest up onto the wall, and that helps eliminate gravity and essentially like helps like realign the pelvis, will decrease the pressure, maybe also help with some of the pain in your back because you might be experiencing pain in your back. A lot of the times people feel, again, if you're a female, they will explain that it feels like a tampon is kind of hanging out. It's like a bulge in your underwear type of feeling, and that's kind of common. It also may be more pronounced as the day continues on because you're standing, so gravity pushes down. If you're a mother and you're carrying baby, or if you're just carrying a load, that also can provoke your symptoms. So you can position your body in an anti-gravity eliminated position to help alleviate those symptoms. But what you can also do too is start again with some breath work, because the breath work, yes, down regulates your system. You might be more on like high drive, but even if you're not, it helps coordinate the breath with the pelvic floor. And so as I was mentioning, if you're someone who lifts or someone who is straining when you pass a bowel movement, we really need to try to control our breath with external pressure, and that's going to really help with some of your symptoms. And then on top of that, once we down regulate and help control those external pressures, we then need to get our core strong. And so that starts with, again, maybe on our back exercises, trying to just breathe and get our core activated while we're moving our arms and our limbs. Then we can progress to hands and knees, kneeling, and then standing. And of course, we need to integrate like functional movement, right? So if bending down and lifting a baby or load is when it most bothers you, we need to make sure that we can breathe appropriately, exhale as we actually are lifting up that load, and start to do exercises in a more functional position. So squatting, deadlifting, lunging, things that we do on the regular, so these symptoms are well managed throughout the day. So again, if there's any questions, you can head over to my Instagram at Holistic Physio Doc, or you can place the comments below and I will happily answer them. Thank you so much.